I'm Allison Ishman, and I'm here at Oakworks today to show you a little bit more of my fascial link therapy training. We're going to start off on the ABC table made by Oakworks. This is a Proluxe Seville with a feature at the top they refer to as the ABC feature. We're going to use that to show you how it can adjust for the spine of your patient, especially when working with women. So we're going to begin by having you get situated for us. I'll have you start face down. And she's going to set herself up so her head is in the headrest. The breasts are right over the ABC area that will change position for us. I'm going to give you a bolster for under your ankles. And we're just going to come around here and grab a stool. This is the saddle stool, which I find to be so comfortable and excellent for posture, for me as the practitioner. This one's a little high. So, to accommodate that, I have a lift table here. I'm going to go ahead and bring it up. Conveniently adjust to save me my back and my ergonomic strain. We're just going to lift it up. And we'll come around the front here. And in this position, I can use the hand adjusters here. Let's just take a look at the curve of the spine. So she has noticeable transition here. We're going to see the sacral area and then the curve in the lumbar spine, the curve in the thoracic spine, and the curve of the cervical spine up here at the top. And then we use a hand adjuster here. I'm going to use my knee to lower that. And you see the change in position for the thoracic spine. This will reduce a lot of pressure, allow us to work more directly with the tissue. Is that comfortable for you? And see how we see a big change in that curve. It really reduces the curve of the thoracic spine, gives us a little bit more ability to work directly with spinal tissue and not be so concerned with the transition of the thoracic spine from the breasts. So for fascial link therapy, we're always going to start with warming. So I'm just going to come in here and do a little compression. While I'm warming, I'm palpating. I'm working superficial to deep, so I'm looking for which structures are tightest. I'm going to come down just a hair while I do a lot of pressure work. And here we're looking to balance fascia, so we're looking for structures that are going to be of similar thickness and tone. We're in the lamina groove right now. It's a structure on either side of the spine. You comfortable? Mm-hmm. Okay. We'll keep checking in with our client. I feel quite a bit of tightness up here in the cervical spine, right at the transition between cervical and thoracic. And then checking it with this side. A little bit less tight over here. So we'll concentrate on your left side. So here we're looking to start off, and we've done some leg work. We're looking to start off with warming, and then we're moving to evening out the tone, different fascial structures. We have secondary fascia to work with here. So this is all along the lamina groove. It's the thoracolumbar fascia in the lower spine, and then the attachments up here at the occiput. I'm going to begin at that spot that we found so tight here, and I'm just going to check in with you about pressure. On a scale of 1 to 5, we're looking for right around a 3, a place she can both relax into and breathe through. So what would you call that? About a 3. And I'm just going to use a link point at the base of the spine. With fascia, I'm using that same hooking technique. I'm going to shift position just a little. It really takes pressure off up top. I'm feeling it change pretty quickly. Better? Is it gone? So it's really pretty fast work. We're looking for a result in somewhere between 3 and 15 seconds. We're going to seek relief. So we're going to ask our client, especially while we're in the learning stages. Sore here? Not too bad. I'll go a little more pressure. 3 on a 5 scale? 4. Pretty sore. I'll give you a link point quickly. So we're applying the dual release technique. We're using a release point 1 at the top, which typically we're looking for a 3. She was actually at a 4. We're using release point 2 in a similar type of fascia. This is both secondary fascial types to release it. Clear? It's really pretty fast work. We're really dealing with tensegrity. The body's structural load pattern, and the fascial link charts provide us with the tools we need to know where to link. Okay, let's do one at the base of the spine. Sore? And then we'll just link that to the occipital base. So I'm using thoracolumbar fascia right at the corner of the sacrum and the iliac crest, and I'm linking that with this attachment on the occiput. Many structures come to attach here. Trapezius, levator scapula, splenius. Sore? Is it clearing? Yeah, it feels like it's really clear in the low back. And as we've done in some of the other segments, we'll just double check the same spot. So am I about the same pressure as before? And is it sore? No. So it really makes a fast transition. It's a nice opportunity to help calibrate different structures along the spine, and a good chance to see the big impact the ABC table has on posture as we're working through soft tissue. Thanks for joining me. If you'd like more information about fascial link therapy, please feel free to visit my website at ibodycare.com, where you can see the fascial link therapy book, or you can look and learn about classes. Thanks very much.